Autoimmune conditions, adenomas, and growth. Any form of development on a gland or organ that generates hormones such as a tumor, adenoma, or nodule could impede its ability to do so. Rare endocrine tumors originate in glands or in cells that manufacture hormones and can cause hormone abnormalities. Some of the rare endocrine tumors include adrenocortical carcinoma and adrenal cortical carcinoma. ACC is a malignant adrenal tumor that originates in the adrenal cortex. It sometimes causes increased hormone production. Carcinoid tumors. Carcinoid tumors are a form of neuroendocrine tumor neck that grows from neuroendocrine cells. Neuroendocrine cells receive and deliver messages through hormones to assist your body function. Thyroid cancer, methythyroid cancer. MTC is cancer that starts in the interior of your thyroid. The mela contains unique cells called seed cells that manufacture and release hormones. Pheochromocytoma. A pheochromocytoma is an uncommon tumor that arises in the center of one or both of your adrenal glands, adrenal. The tumor is formed of a special type of cell called chromaffin cells which manufacture and release various hormones. They're normally benign but can be malignant paraganglioma. A paraganglioma, also known as an extrapheochromocytoma, is an uncommon neuroendocrine tumor that originates around your carotid artery along nerve pathways in your head and neck and in other places of your body. The tumor is formed of chromophil cells which generate and release various hormones. An adenoma is a benign non-cancerous tumor. Many adenomas are non-functioning, meaning they don't produce hormones, but some can create extra hormones. These are called functional adenomas. Adenomas that impact your endocrine system and induce hormone abnormalities include pituitary adenomas. Pituitary adenomas can cause an imbalance in any of the hormones your pituitary gland generates. For example, pituitary adenomas are the most prevalent cause of acromegaly, excess growth hormone in adults, adrenal adenomas. The most prevalent cause of Cushing's syndrome, excess cortisol, is an adrenal adenoma on the adrenal cortex. Parathyroid adenomas. A parathyroid adenoma can induce primary hyperparathyroidism, excess parathyroid hormone. Other growth other than tumors and adenomas on endocrine glands can induce hormone abnormalities. For example, thyroid nodules, an unusual development lump of cells in the thyroid gland, can induce hyperthyroidism or hypothyroidism, damage or injury to an endocrine gland. Any form of damage or injury to an endocrine gland can produce hormone imbalances. Usually a lack deficiency of hormones. Damage could happen from the following conditions or situations: accidental damage from surgery. For example, roughly 75% of hypoparathyroidism. Low parathyroid hormone cases come from accidental damage to your parathyroid glands during neck or thyroid surgery. Excessive blood loss or lack of blood flow to an endocrine gland. Lack of blood flow can cause tissue to die, necrosis. For example, Cushing's syndrome, a cause of hypopituitarism, can emerge when a person experiences considerable blood loss after childbirth, bacterial or viral illness. For example, hypopituitarism can be a consequence of bacterial meningitis. Albeit this is unusual, radiation therapy for cancer treatment can harm endocrine glands. For example, up to 50% of those treated for head and neck cancer with radiation therapy develop hypothyroidism. Brain or head trauma, sometimes called traumatic brain injury or TBI situations such as a vehicle accident, a fall, or contact sports can cause head trauma and brain traumas which can cause damage to your pituitary gland or hypothalamus. Autoimmune conditions. An autoimmune disease arises when your immune system accidentally targets a portion of your body instead of defending it. It's unclear why your immune system does this. If your immune system targets a gland or organ that generates hormones, it causes a hormonal imbalance. Autoimmune endocrine disorders include Hashimoto's disease, Graves' illness, type 1 diabetes, Addison's disease, polyglandular syndromes. Diagnosis and test. How are hormonal abnormalities? Diagnosed healthcare practitioners frequently conduct blood tests to evaluate hormone levels. Since your endocrine glands release hormones straight into your circulation, certain hormone levels vary considerably during the day. Therefore, Clinicians may prescribe further tests to monitor your levels, such as a glucose tolerance test or insulin tolerance test. Your provider will also ask you about your medical history and symptoms and do a physical assessment, management and treatment. How a hormonal imbalance is treated. Treatment for a hormonal imbalance will depend on what's causing it. If you have lower than normal hormone levels, the principal treatment is hormone replacement therapy, depending on whatever hormone is insufficient. You may take oral medication, pills, or injectable therapy. For example, if you have low thyroid hormone levels, hypothyroidism, your provider can prescribe synthetic thyroid hormone supplements. If you have growth hormone deficiency, you'll likely have to take injections, shots of synthetic growth hormone. If you have higher than normal hormone levels, there are several therapeutic options depending on the cause. Options include medication, surgery, radiation therapy, or a combination of any of these. For example, if you have a prolactinoma, a benign non-cancerous tumor that creates excess prolactin, a hormone, your provider may give a medicine to decrease the tumor, or you may need surgery to remove it. How do you correct hormonal imbalance? Many health issues that entail hormonal abnormalities, such as diabetes and thyroid disease, require medical therapy. Many nutritional supplements in stores promise to address different hormonal imbalances, but few of them have been clinically confirmed to have a therapeutic effect. It's crucial to always talk to your healthcare physician first about using supplements. Aside from medical treatment, your physician may recommend some lifestyle modifications to assist manage a hormone imbalance, such as reducing your stress levels and obtaining frequent exercise. What kind of doctors handle hormonal imbalances? Primary healthcare providers can identify and help you treat many hormonal disorders, but you may benefit from consulting an endocrinologist. An endocrinologist is a healthcare specialist that specializes in endocrinology, an area of medicine that investigates diseases related to your hormones. They can diagnose endocrine hormone disorders, devise treatment and care strategies, and prescribe medicine prevention. How can I prevent a hormonal imbalance? While many hormonal imbalances aren't prevented, there are certain things you can do to maximize your general health, which could help keep your hormones balanced, including maintaining a healthy weight, eating a balanced, healthful diet, exercising regularly, managing your stress, getting adequate quality sleep, managing your chronic health conditions. Well, if relevant, quitting smoking or using tobacco products. If you smoke, living with. When should I see my healthcare practitioner regarding a hormonal imbalance? If you're experiencing new persistent symptoms, it's crucial to talk to your healthcare professional. They can prescribe tests to determine the cause of your symptoms. Important milk hormones are complicated and potent substances. If one or more of them goes out of whack, it might create specific symptoms that make you feel like you're not in control of your body. If you have new and persistent symptoms, it's crucial to talk to your healthcare professional. They can conduct certain tests to discover if hormonal imbalance or another condition is the culprit. The sooner you reach out for aid and treatment, the sooner you'll be able to feel like yourself again.